Hello, 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 everyone. Come on in. Listen, we are here on the Green Table Live Senior Care Talk Show. We're here on a Friday at 12. But listen, we have some special guests. We have some special things going on. We have our quarterly professional brunch happening right here, right now at our corporate office here in Americus, Georgia at 231 West Lamar Street. And so we have healthcare professionals here networking, collaborating, sharing their resources. The tool and the goal is to take down silos. We so many times as service providers, we work in silos, but we have such great services and resources to share to our communities, and we felt like we needed to have everyone come under the same roof and share resources and how we can help seniors, those with disabilities, intellectual disabilities, find resources and services to help them stay in their home and community longer. So if you know someone, if you know that this would be beneficial to a caregiver, a healthcare professional who needs to be in the room, go ahead and tag them in the comments, share this on your platform, because listen, we have a mandate to share information to help seniors, to help caregivers, to help business partners get their services that they provide out there to help individuals that they serve stay at home and in the community longer. So listen, that is what we're here doing today, quarterly healthcare professional brunch here at Innovative Senior Solutions corporate office. We do it every quarter, so definitely look for the next one. If you can't join us today, it'll be happening in November. We'll be dropping the date soon, and so you can put it on your calendars. But listen, I have some special guests that are going to join me here. These are healthcare professionals that are in the room. They're, again, networking and mingling, collaborating, sharing their resources. So I wanted to bring them on the green table with me. So you can also hear from them and see the benefit of coming if you're a healthcare professional, being in the room, being a part of the quarterly brunch, and how beneficial it is. So who I'm going to bring up, we're going to bring up Deborah Gilbert. She is with CHS Georgia Home Health, and so she's going to talk to us. Come on in, Miss Deborah, and welcome to the green table. Come have a seat with me. Welcome, welcome, welcome.
Thank you so much for having me.
I tell everyone, this is a breeze. I don't want you to be nervous. We're going to have a good time. We're going to talk to our social media family, our community, and we want to let them know. Let's start out with just telling them who you are, what service, what agency you're with, and what services do you provide.
Okay. Hello, everyone. I'm Deborah Gilbert. I am the administrator for CHSGA Home Health in Albany. And we're a home health company that provides in-home services for people 18 and over. We provide disease process management like high blood pressure, diabetes, for strokes, respiratory, CHF, COPD, and an array of things. We provide skilled nursing, physical therapy, occupational therapy, speech therapy. Post-surgical care, so if you had some kind of surgery and you can't really get around, we can come in and help you with that. We do wound care. We work with people that's having falls, fall prevention, health education, medication management, and we also do IV therapy. We just do an array of things. So we just need you to have your doctor send us a referral. We'll be more than happy to come out to see you, and we accept most insurances.
What area do you cover?
We cover 13 counties. Doherty, Terrell, Randolph, Early, Calhoun, Colquitt, Grady, Thomas. Most of the ones we cover. So it's 13 counties. It's Southwest Georgia. Yes.
So the Towega area. And listen, I always like to share this because we talked about this a lot. And I want you to elaborate on home health different from home care? Because a lot of people said, well, I need a nurse to come out. I need help with, like the medication, setting up my medications. I need IV therapy, and they kind of get it mixed up with home care.
Yeah.
So tell the individuals what differs, how you differ from home care.
Well, with home health care, you have to have a skill service. Whereas with home care, it's more providing with your ADLs and your ADLs, like just doing your bath, running errands, cleaning, and things like that. But for us, you have to have a skill care, and it has to be ordered by your physician.
And most time it's short term, right?
Yes. Well, it depends. We do 60-day periods. And if you need it longer than that, we go as long as you need. Say if you have a wound, it does not heal in 60 days. So we're gonna work for you until we can get that wound healed, or your doctor says, we don't
no longer need it. Mm-hmm. I think the major difference from home care, like you said, home care is more non-skilled, where home health is skilled, but the payment method. So I always like to talk about this. Home health use Medicare.
Medicare and private insurance. And Medicare pays 100%.
Yes.
Of home health care.
Whereas home care is Medicaid. So that is the difference. I know a lot of people always get that mixed up. So I'm so glad you're here in the room. Tell me what brought you to the healthcare professional brunch. Why are you here today? What was your goal today?
My goal today is to reach out to as many seniors as I can to let them know this service is available, because a lot of people, like you said, don't understand home health and home care. And, you have loved ones that you want to stay at home as long as possible. So we're there to help them regain their ability to, fall prevention, help them with the disease processes, make sure they're taking their medications correctly, even if they have a wound, to be there to help them heal that wound as well.
Yes. So this is important, why you as healthcare professionals need to be in the room so you can network, you can collaborate with other services to tell individuals, because again, the number one goal is to help the clients, the members be able to stay at home longer.
Yes.
So any lasting things that you want to share with the audience that you haven't covered yet before you leave?
No, I just want to make sure everybody understands that we're here and we're available. Just give us a call and we can help you through the referral process as well. If you need us to contact your doctor, if you have some issues going on, we're here to get you with that process as well.
Can you give them your contact information?
My contact is Deborah Gilbert. My number in Albany is 229-435-2109. My email, dgilbert@chsga.org.
All right. Well, you heard it here right from Deborah Gilbert about the importance of home health, what they do, what they offer, and how they can help you if you're in need of any skilled nursing services. All right.
And not only nurses therapy, we do therapy as well.
All right.
Therapy. Okay.
Thank you, Ms. Deborah.
Thank you so much for having me. You have a good rest of your day.
You're welcome. Thank you. All right. So listen, you gotta be here. You need to mark your calendars. You need to be at the next quarterly healthcare professional brunch where you can network and collaborate with other organizations, other healthcare professionals, share what you do, and then get information, provide information, and then hopefully this will help bring services to your organization. So again, we are here at our corporate office in Americus, Georgia, where we are hosting our third annual quarterly healthcare brunch. We have another special guest. It is Jeremy Hudson. He is with the marketing of Graceful Hand Home Care. And come on in and join us. Jeremy, how are you today?
I'm doing good. How about you?
Good. Listen, Jeremy, tell the people why you're here today. What was you looking to gain from coming to the professional brunch?
Yes, ma'am. So I'm here to be able to network with people and be able to see what providers and resources that are out there, so we can talk with so we can help our clients and patients out with what they need. Um,
Okay, so listen, you gotta be in the room. Healthcare professionals, we have an array of individuals you're gonna see. Jeremy, tell me, what do you do at Graceful Hands and what is Graceful Hands?
Yes, ma'am. So I'm the marketing specialist at Graceful Hands,
Mhm.
and we offer in-home non-medical care services, and if requested, skilled nursing as well, and work alongside hospice. So if there's somebody, a client or a patient that's wanting to stay at home, they don't want to be in a facility, and we can even offer sitter services as well at the facilities, but we're mainly offer that in-home care where we take care of people in the home. We do bathing, cleaning, grooming, and etc.
So listen, we just talked to Miss Deborah who did home health, and she told us the difference between home health and home care. And look what we have. We have a home care provider here, and so they focus on non-skilled services, like you said, the ADLs helping with bathing, dressing, preparing meals, light housekeeping.
That's right.
But you can do some skilled services.
Yes, ma'am.
as well.
If that's requested, yes, ma'am.
Okay. Well, awesome. See, look, we have everyone here in the room. So listen, if you are a caregiver, you are a senior, you are a healthcare professional, you need to be in the room. Here on the Green Table Senior Care Talk Show, we talk about all things here. But today we're focusing on our healthcare professionals. And so again, we have Jeremy here from Graceful Hands. Jeremy, is there anything else you would like to tell the viewers about Graceful Hands and what you all offer?
So we also serve most of South Georgia and Metro Atlanta. That's good to know for any viewers out there that are outside the South Georgia area, that may stay in Atlanta as well. We also offer like workman's comp, and we just became proud partners or providers of the VA. So if there's someone y'all know that's part of the VA and that's needed home care, then we would love to be able to take care of them.
Well, how can they reach you?
So they can reach us either through our website, which probably be the best place so they can fill out a form, but at www.gracefulhc.com. Again, that's www.gracefulhc.com, or you can give us a call at our office at 229-938-1528.
All right. Well, you heard it here right on the Green Table Senior Care Talk Show. You have received resources from home health, now a home care provider. Again, the goal for us all here, healthcare professionals, is to be able to keep individuals in their home and community longer. So we want to again thank you, Jeremy, for coming on. Is there anything else you would like to share before you leave? All right. Well, thank you for coming in and joining us. And please continue to go out and network and collaborate.
Thank you. Thank you for having us.
All right. Thank you. So listen, we're having a great time here at the quarterly healthcare professional brunch. We have everyone here in the room. So listen, if you are a healthcare professional and you are not in the room, you need to get in the room, because listen, we have everyone here where you can network, you can collaborate, and we can most importantly help individuals that want to stay at home or in their communities longer. And so again, I will be dropping the date of our next quarterly healthcare brunch, so you can make sure you mark your calendar and you get in the room. So listen, I have one last guest before we end, but before I bring her on, again, I just want to make sure you know about the Green Table Senior Care Talk Show. We come on live every Monday at 6 p.m. Here on Facebook, we're on Instagram, we're on YouTube, we're on LinkedIn, all your social media platforms, we are there. The purpose of the Green Table is we want to bring awareness. We want to bring awareness, we want to bring resources, we want to help caregivers navigate this new world of trying to get resources and help keep your loved one at home or in the community longer. So we want to join, invite you to the community, share this on your platform, because listen, this is going to hit every single household. Either you're going to need caregiving, you're going to provide caregiving, or you have done it. So either way, it's going to hit every single household. And so we want to get you geared up. We want to get you with the resources. We want to, again, get you everything you need so you can help keep your loved one at home or in the community. So I have one last guest, Michelle McClellan. She is with Pruitt Health Parkwood out of Valdosta, Georgia, and she's going to come on. Welcome, welcome, welcome. How are you today?
Hey, I'm good.
Good.
Thank you for inviting me.
Yes, and so I want you, because when you introduce yourself in the brunch, I was very intrigued. I think this is a resource that is not talked about, but it's much needed. So I definitely want to have you on the green table. Tell our viewers what you do and what you provide.
Okay.
What you do.
I am Michelle McClellan. I'm the admissions director at Pruitt Health Parkwood. We are a residential and developmental learning center. So we are a little bit unique within the state of Georgia. We're the only ICF, which stands for Intermediate Care Facility. Years ago, the state kind of shut down theirs. So we are privately owned by Pruitt Health, and that's why we are still here. We are residential care for individuals with intellectual and developmental disabilities. So that would be like severe autism, Down syndrome, chromosomal disorders, people who have cognitive and adaptive disabilities. And they can come and live with us. It's a residential setting. There's semi-private rooms. We have male and female wings, and we are set up to take all ages. So this is actually a Medicaid benefit through the state. ICF type of care is, though, if someone has community Medicaid, they can come in for long-term Medicaid into our facility, and that's what covers. So they have room and board. They have an entire activities plan. We have a 16-hour-a-day routine. We have 24/7 nursing care, behavioral team, direct care staff, of course. So some people need help with ADLs. Some people need assistance. They might be wheelchair bound, or we have people who are not wheelchair bound. And then we have, like I said, all ages. So our youngest is 13. Our oldest is 82 right now.
Wow.
So we have about 13 that are still in school.
Okay.
And so they receive their whole, home life environment within our system. And then they can even age with us. So some people have been with us for 20 or 30 years. And we have a lot of families who are still very involved in their care. And it's a very difficult decision for someone who's been dependently needing care from their family, for them to make that decision to place them in a facility away from home. But a lot of our families have really benefited from being able to have someone else that can provide that 24/7, even nursing care or just behavior attention, and also the family still being able to come and go, visit, take their loved one home, and just have kind of an ease that they're getting the appropriate care that they need.
That's right. Wow. I was blown away because I had no idea that you all were there and you all provided this much needed service, and that it is provided for all ages, and you individuals can come from all over the state.
Yes, we have people from all over the state, but we're located in Valdosta, Georgia. And that's where we are. But again, we take people from all over the state. And so we just have an admission process where they complete an application with us, maybe get us some medical records and some psychological or IEP type of things if they've been in school recently. And then we usually have people come and do an actual tour and an in-person interview. So the clients can see our facility. We can see if they, and our staff can see that it's someone that they can work with and provide whatever they need. The families are able to see that they feel comfortable with leaving their family member with us. So.
Awesome. And this benefit is covered through Medicaid.
That's right.
And it's long-term care.
Mhm.
I want to make sure I'm hitting all the
Yes.
things. And this is for individuals who have autism, developmental
Yes.
disability.
Intellectual and developmental disabilities.
Yes. So this is a much needed service because, again, as Michelle said, a lot of the state hospitals have closed, and so they're not available. This is only one in the state.
This is the only one in the state. We're privately owned by Pruitt Health. So other than ICF, which is what we are, the other options for residential care if someone in that population cannot be cared for in their home would be group homes. And that's through DBHDD. So, and some of the waiver programs provide assistance for that. So that's the other alternative. And then we are, as far as other options.
So question. So this is for individuals who cannot get on the DBHDD pro waiver. Is this the next option, or
Well,
what would you say to
It's
that?
a good option for people who might have never applied for DBHD services because it is a process with them sometimes,
Yes.
and there might be a wait list. I wouldn't say it's an alternative option necessarily, but for some people who even have been on the wait list, they might have a medical need that a lot of group homes couldn't provide for, and are set up with having 24/7 nurses might be able to meet that need that they might. And it's different for every area throughout Georgia. There are certain group homes that can provide nursing care and some that can't. So it's good that we have this option in our state just so that families, because every family is different, every individual is different. So some people might meet a certain criteria for certain things and some might not. And so just to even have this available as an option for families or individuals, depending on what their need might be, is really awesome to have that as a resource in our state.
Now tell me, is there a wait list? Is there?
No, we don't have a wait list.
Wow.
Yeah.
Okay.
So like I said, just contacting us, and we have an application that I would be the one that they would normally be talking to as the mission director. And then I would send them an application, and we kind of work through the process of getting medical records and different things with them and setting up a time that we can do that interview as a part of our process to see if we can meet their needs.
Wow. So tell our viewers, how can they contact you?
Absolutely. So you can actually reach me directly at 803-522-4418. You can look us up online at PruittHealthParkwood.com, at the PruittHealth.com website, and then you can look at Parkwood. And then you can see all of we actually have kind of a virtual tour that you can do to see our building, get a better idea about our facility. And you can email me at michelle.mcclellan@PruittHealth.com also.
All right. Well, you heard it right here. We have everyone here in the room. And so if you are a healthcare professional and you are not here, listen, you need to get here. Lastly, tell us how beneficial, because you came from Valdosta, that's like 2 hours. So how beneficial was it for you to get in the room?
Absolutely. This is very beneficial because, again, not very many people know about Parkwood, and this is a resource that's kind of difficult to get the information out there to the families who are looking. And so for me to be able to network with different healthcare organizations who are in people's homes, in the community, they might be able to, different home health agencies might be working with an elderly person who is the primary caregiver for someone with developmental disabilities. And so just to be able to go into different communities and find people who are working with those individuals, just for the time when that is the right person who happens to need our resource, is just really beneficial and very helpful, actually. So
Wow.
I appreciate it so much.
Well, good. I'm glad you made it here. And I want to personally invite you back where we can have a full segment on the green table, because I just feel like this is such a limited resource and so many people need this. I'm glad I have it now in my repertoire, my arsenal. And so, because I do meet a lot of people who need resources, whether their caregiver has aged and no longer can take care of them. So I want to be able to give them great resources. So thank you again, and I will be reaching out to you
Absolutely.
to have you on the green table.
I appreciate it.
All right, thank you. So listen. Again, if you are not in the room, you need to get in the room. If you are a healthcare professional and you provide some type of service to individuals that will help keep them in their home and community longer, you need to be at this brunch. Because again, we want to tear down the silos of us working in quietly in our own little nest, in our own little space. And so we can get the information out to individuals, caregivers, families, individuals who need this service, other providers who come in contact with individuals that would benefit from your service. So you need to be in the room. And so listen, follow us on any social media platform, Innovative Senior Solutions, so you can stay connected and you can be in the room for our next quarterly professionals brunch. So listen, you heard it here, right here on the Green Table Senior Care Talk Show. If you know someone, anyone here in our community, if you know a healthcare professional that needs to be in the room, share this, tag them in the comments so they can get in the room. Again, thank you for joining us. Again, we want to see you on Mondays at 6 p.m. is where we have our Green Table Senior Care Talk Show. And again, it is our mandate to be able to bring information, resources, give insight, be a support, have a community of caregivers, professionals, healthcare professionals in the room where we can help equip you to better take care of your loved one and support them as they want to stay in their home and communities longer. We have it right here on the Green Table. So again, thank you all for joining us, and I look to see you here on Monday at 6 p.m. Thank you. Y'all have a great weekend. Bye-bye.